The information discussed in this episode is general in nature and it is not intended as personalised medical advice. Individual assessment and consultation with a doctor are essential before considering any treatment. So, welcome.
Yes, welcome.
Our first episode. Welcome to Aesthetics Unfiltered, Kerry.
Thank you for having me.
Where we have honest conversations about regenerative doctor-led aesthetics.
How did I get here?
Yes.
Well, it started a long time ago.
Good.
My interest first was, I suppose, with skincare, came from working with a dermatologist. Well, there were 3 dermatologists here in Geelong, and I noticed that one of them was more sort of skewed towards the anti-aging than the other 2.
Right.
And that then sparked my interest on what sort of, I suppose, skincare, that type of thing that he sort of was promoting. Well, not promoting so much, but what he was prescribing.
Right.
Because it was prescription Schedule 4. And it was amazing, the quality of skin and how the difference with the patients that were using it. The health of the skin was what really caught me.
Okay, so that's how you first became interested in aesthetics, or what was the next step after the dermatologist?
Then I then noticed that there was an ad for I'm just trying to think, it was with Neve in her plastic surgery rooms, and it was, we were at the Jerringhap Street Old Church, can't think what it was called, St Giles, it used to be a nightclub at one stage, and there was an ad in the paper, and I thought, I think I might like to go for that position, and then that was how that started.
Yeah. Only a few years ago. Yeah.
Just a few. But yeah.
And then you worked with Neve ever since?
Yes, so Neve actually, her clinic was the first of its kind in Geelong. So it was the first breakaway clinic from a traditional plastic surgeon's rooms. So I was down at the waterfront. I think she was there for about 12 months, outgrew it very quickly, and then purchased at St Giles. It was St Giles Church in Jerringhap Street. And she had the surgery side, and I was the practice manager for the surgery side. And then we had the non-surgical side, which was the cosmetic refinement clinic, and that was a separate name to the surgery side.
Yeah.
And from there, this is where it all went. And now we're here at River End in Newtown.
Great. And you're very, very interested in skincare.
I love skin, skincare.
Yeah.
I think it's one of the most important things that if you're interested in looking after your skin, it's one of the most exciting things that you can do to change the quality of your skin.
Yep. I certainly go to you for most of my skincare advice because, you do a lot of the extra training, meeting with the reps every month.
Yes.
And I suspect you've tried many, many different types of skincare over the years.
Yes, so if they're claiming that it does a certain thing, because I have very, very sensitive rosacea skin.
That's helpful.
I try it and I can normally tell within about 4 days of whether I'm lumpy, bumpy, red, and it's not going to work.
I think as unfortunate as it is to have sensitive skin, you're kind of lucky that you do because you're able to try so many different products and give genuine advice to patients.
Well, it's very hard when you have skin that isn't great. So it is one of those things where if you know about it and you're interested, which I certainly am.
Yes.
It's really exciting, the stuff that's out there.
Yeah.
It's just frustrating when you hear certain people that really have no background in skincare or the industry talking about named products that actually they probably don't use on their skin themselves.
Yeah.
Or you look at their skin and they wouldn't be needing to use that type of thing.
Yeah.
But that's the way it is. Marketing is a wonderful thing in some things and it's shocking in others.
Yeah.
And influencers.
Yes, yeah. I think it's become really difficult, particularly in Australia in the last few years with all of the regulations changing for doctors, nurses, other healthcare practitioners who are practicing non-surgical medicine. There's been massive changes to what we're allowed to advertise and what we're even allowed to discuss.
Yes.
So I can run you through those changes if you like.
Well, before we do that though,
Yeah.
how did you find us?
Probably need to introduce myself.
Yes.
So I'm a GP. So I studied medicine, became a doctor through Monash University. I went straight out of high school. So I was pretty young. I completed general practice training along the Surf Coast. So I was in Camperdown actually and Lawn. And then I went and practiced as a GP in Darwin during the pandemic, which is very interesting. So I feel like I learned a lot about many, many different aspects of healthcare. And at that time, cosmetics was not even on my radar.
No, it wouldn't be.
And one day
Well, we
in
were all
Darwin,
closed in COVID.
well, we were, yes. Darwin wasn't. We were very lucky up there. Yeah. I got into cosmetics because I had a friend who went to have a non-surgical treatment. It didn't go very well. And I thought, seriously, how hard can it be?
And what did you find?
I did find, once I contacted you and Neve to learn about what sort of training was available, I learned that it is quite complicated and you do need pretty significant training to be able to do cosmetic medicine well. So I came and started working with you and Neve. And I actually went back to uni. So I did a postgraduate diploma of aesthetic medicine through a university in the UK, which took 12 months. Going back to uni was not fun.
Yes, I was not. I was thinking, oh, you poor thing.
Wouldn't recommend it again. But I learned a lot. And I think having that background in general practice was really helpful. So, yeah.
I think you're right, because I see you bring that into so much of your consultations with patients.
Yep.
Because you have that really good broad knowledge in that area. It really works well with when you're talking about treatment plans, taking their medical history and then working out from there treatment options. You really do need to have very, very good medical background because there's a lot of things, as we know, in this industry that we do that if you have a bit of a complex medical history, you're wasting your time and money by actually having it done. And I'm sure there are other clinics that do the treatments without realising that in actual fact this patient is going to get no actual result or benefit because of their compromise.
That is something that...
their medical history.
Yeah, I find pretty frustrating when a patient comes in for the first time and I'm consulting with them and you look at what treatments they've had and you just think these were never going to work for you.
No.
So,
and it's
I think...
all the money that they've spent.
Yeah, exactly.
And then that gives us, all of us, a bad name because it's like we're a sales clinic and we shouldn't be a sales clinic because even what you're putting on your face, what we sell here is medical grade. It is superior. And
Mecca products,
it is to anything that you can get at the big department stores. You know, there's some lovely, fluffy, nice things that you can have done with a beauty therapist. But if they're not done at a medical level clinic, they can't even have the upmarket of what we call the peels and those types of things.
Stronger strengths.
Things that are going to hydrate and do all of that great restorative skin barrier stuff.
Well,
they just won't be allowed to have it because the companies don't sell to them what we have. So obviously, you know, with the changes in the industry, you came in before they were really cracking down. And then, I mean, I've seen huge changes over 10 years, but you as a doctor coming in at the start of when you were doing university and then all of a sudden we go to a conference and we're told, guess what, guys, you're doing it all wrong. And we had to go back to the drawing board.
So essentially, right when I started doing extra training in cosmetic medicine is when all of the guidelines for doctors changed in Australia. So the TGA, the Therapeutic Goods Administration in Australia, who regulate all of our medicines and most of our medical grade devices, they've changed the rules on what we can and can't say to patients. So many non-surgical treatments are actually classified as Schedule 4 drugs. So they're medications and they require a doctor's prescription, which means that we're not allowed in Australia to talk about them or educate our patients online. We're not even allowed to advertise, say, anti-wrinkle treatments on any of our websites as medical-led cosmetic clinics, because that alludes to the use of a Schedule 4 substance. So the rules are quite clear and they're quite strict.
Yes.
It's probably for the best, I think, but it does make it quite difficult for patients to obtain good information from a reputable source. So I think we've found a lot of our patients going online for information and having to look overseas. So they get a lot of their information from America and from the UK, where they doctors and nurses aren't subject to the same rules. Unfortunately, that means that a lot of misinformation is spread, and it makes it very difficult for Australian patients or anyone interested in any non-surgical treatment to find the right information. So hopefully this series can help people a little bit with
finding their way.
Yeah.
And I think the interesting thing to note is every state in Australia basically runs under a different set of rules. So we have the Poisons Act. There is, each state will have a completely different set of rules on how their Schedule 4 drugs
are prescribed and dispensed and administered.
And especially in the aesthetic industry, we have seen huge changes in some of the states. So while you see things on social media, it might not be relevant to actually us here in Victoria, and certainly what we are talking about might not be relevant to Queensland, because they have gone through a huge change of thing. We are told that there's more
changes coming.
I would think that maybe it's going to be when we go to NSS in Sydney.
We might get a bit more information.
We might get some more there. But you're right, it's very hard. And I think the frustrating thing is because we can't talk about it. So not that we ever had a price list on our website, because to me, I think we've always come from a place of following on from Neve. We've always been medical and very medical focused, even when we had the non-surgical side at the start. So for us,
there's no
consent forms, all of that sort of thing were all already in place for us. So for us moving over to those new rules was quite easy. But
and I think
the website was our biggest thing. We had to change all of that because we can't talk about anything.
No. I think non-surgical aesthetics, all cosmetic treatments, that there shouldn't be a treatment menu for patients. It should be that if you're going to have a treatment at all, it's individualised and it's tailored to that specific person's medical needs and in consultation with a doctor.
It's not like a takeaway menu.
Yeah, exactly.
It's and I think that's the thing. And we have always been like that. I think you would agree that patients have never been able to just ring up and go, I want to book in for X, Y, or Z.
This is what I want and this is what I'll be having.
They've always needed to come in for a consultation. And that has always been, for as long as I've been in the industry working alongside with Neve, that has been our go-to. So I think for us, we were already really well placed in the industry. There was things that we had to change, obviously, on our website to be compliant, and there's certain things now that we just have to be more mindful of, especially even just doing this sort of talking and podcast, where we can certainly give out some
very generalised advice.
General advice. But yes, it's not specific, and it's very frustrating when you see the influencers talking about. Like, I watched something the other day on Instagram, and there were people, they were all getting ready to go off to the Grand Prix. So it was really great. I love the fashion, all of this sort of thing. And they were talking about, they were going off, and we saw them in their beautiful clothes. And then there was a couple of people asking them, obviously sending through messages, I'm assuming, what do you use on your face? Your skin looks great. And they're talking about these Schedule 4 drugs that they've had done to their face. And they're talking about what they do. And I'm there thinking, but that doesn't do that.
Yeah.
This isn't right.
Yeah, so
you
lots
shouldn't have people talking about this stuff.
No, lots of misinformation out there, which
Yes.
makes it very, very difficult for people to find the right information. So hopefully our little series is helpful for people who want information from a more reputable source. So I'm a doctor and you're a skincare guru with lots of experience in the industry. So hopefully we can provide generalised information as best we can within the Australian restrictions.
And probably too, we could put it out to the patients that send in, you know, if you're wanting to know about things on the podcast that we're doing, send in your questions, because there will be certain things that we certainly can talk about and give some guidance on yes, no, there's absolutely no medical sort
evidence
of
for some
evidence,
things,
and that way we can sort of maybe help them and point them in the right direction of
exactly.
where they can find some information. Anything from skincare, non-surgical, we have to be careful, but we can certainly help them in some way.
Yeah, sounds good. Looking forward to it.
So stay tuned.